Have you ever wondered about the complex world of emergency medicine, where every decision can have profound effects on a patient's health? Today we delve into the intriguing subject of gastric lavage, a procedure often used in cases of drug overdose or poisoning. But wait, did you know that there are certain circumstances under which this life-saving procedure should be avoided? Gastric lavage, or stomach pumping as it is colloquially known, involves the insertion of a tube from the nose or mouth down into the stomach. The purpose? To remove ingested substances that could cause harm. Yet, as useful as this procedure can be, it is not always the go-to solution. There are instances when it could cause more harm than good, and in these cases, it's crucial to know when to steer clear of gastric lavage. One of the primary conditions in which gastric lavage should be avoided is when a patient has ingested a corrosive substance. Acids, alkalis, or other corrosive agents can cause severe damage to the esophagus and stomach. Attempting gastric lavage in this scenario can risk perforating these already inflamed and damaged tissues, leading to life-threatening complications. Another situation where gastric lavage should be avoided is in cases of hydrocarbon ingestion, particularly when the hydrocarbon has a high aspiration risk. The procedure could potentially increase the risk of these substances entering the lungs, which can lead to chemical pneumonitis, a serious and potentially fatal lung condition. Patients with decreased levels of consciousness without a secured airway also fall into the category of those for whom gastric lavage is contraindicated. The risk of aspiration, or the entry of stomach contents into the respiratory tract, is too high in these patients, making the procedure perilous. Also, if a patient has ingested a substance with a large size or sharp edges, like certain types of drug packets or foreign bodies, gastric lavage should be sidestepped. The procedure could cause these objects to lodge in the esophagus or perforate the stomach or intestines. Lastly, in cases where the ingested substance is not likely to be effectively removed by lavage, such as with iron, lithium, or sustained release tablets, it is best to avoid the procedure. To sum up, gastric lavage is a valuable tool in the world of emergency medicine, but it's not a one-size-fits-all solution. It should be avoided when a patient has ingested a corrosive substance, a hydrocarbon with a high aspiration risk, or a large or sharp object. It's also contraindicated for patients with decreased consciousness without a secured airway, and when the ingested substance is unlikely to be effectively removed by the procedure. Remember, every medical procedure has its place, but understanding when not to use them is equally, if not more, important. Knowledge is the most potent tool in the medical world, and with it, we can ensure the best outcomes for our patients. Stay curious, keep learning, and let's continue to unravel the mysteries of medicine together.